Now moving to health. A doctor's handwriting on any medical report can convey anything from good, not too good, to severe and even life-threatening information for a patient. Hence, when illegibly written to the extent that prescriptions or dosages may be wrongly interpreted by the patients, pharmacists or fellow physicians, it can lead to significant fatal medical outcomes. In this report, medical professionals say checks have now been put in place to avoid errors occasioned by doctors' hard-to-decipher handwritings. Trust TV's Aisha Salihu has details.
According to reports by the Institute of Medicine, about 1.5 million injuries occur each year because pharmacists and healthcare workers misread sloppy handwritings. But physicians have attributed the rush to attend to multiple patients as a busy clinic, leading to overworked hand muscles, jargons of the profession, lack of attention as factors responsible for this. Dr. Agboe Buta, a family physician, says writings considered illegible on the part of some medical professionals are not a deliberate act meant to reduce the risk of transfers or continuous use of prescriptions by patients in order to avoid cost of consultations. He, however, says there are variations in the pattern of handwritings irrespective of the profession.
Even if we write illegibly, the person who is interpreting it at the end of the pharmacy can also misinterpret it, either as a result of a similarity of your writing or his or her interpretation of your writing with certain drugs he or she has in mind. Most prescriptions would have basically 4 components: the name of the drug, the dose of the drug, the frequency at which the drug is taken on either on a daily basis or as specified, and the duration of use of this medication. So each of these subcomponents can be affected by ineligible writing.
On the part of pharmacists, who are often believed to have the capacity to decode these illegible prescriptions, some precautionary measures are said to be put in place to avoid medical errors and significant life-threatening medical outcomes.
There is a term they normally use in conveying the message to us. It could be OD or BD or TDS. So what I'm having in my front here is written like TOS. But me as a pharmacist, I know what the doctor wants is TDS. So in the event that we are not able to get what exactly does the doctor want, we get back to the doctor and ask him to kind of write it very clear. At the end of the day, we try to kind of, avoid any error that prescription can cause.
Although many are worried about the implications of doctors' illegible prescriptions, even with the advent of electronic medical records and prescription system, experts say there are checks and balances in the structure of the healthcare system, which, if properly implemented, will avert any health implication.
Adverse drug reactions from errors in dispensing, which arise from errors in prescriptions and with implication for the health of the patient. So when you have seen your patient and you get to the point of the prescription, you must remember that you have to be alert.
Illegible handwritings may lead to confusion, which can cause delays in treatment and mistakes causing fatal medical errors, hence the need for caution on the part of practitioners. Aisha Salihu, Trust TV News, Abuja.